Hello everyone, Dr. James Whitaker here, and today I'm going to share with you one of the most important connections in men's health that could literally save your life. We're going to explore why erectile dysfunction isn't just about what's happening below the belt. It's often your body's first warning system for serious cardiovascular problems that are brewing inside your arteries. If you've been experiencing erectile dysfunction and dismissing it as just a normal part of aging or stress, I need you to pay very close attention to what I'm about to tell you. The science I'm going to share with you reveals that erectile dysfunction can be your body's early warning system for heart disease, stroke, and other life-threatening cardiovascular conditions. Most men don't realize that the same tiny blood vessels that create strong erections are identical to the ones that feed your heart muscle. When these microscopic vessels start to fail in one area, they're likely failing throughout your entire cardiovascular system. This means that erectile dysfunction often appears years before chest pain, shortness of breath, or other obvious heart symptoms. Today, we're going to dive deep into the fascinating world of microvascular health and discover why your penis might be the canary in the coal mine for your cardiovascular system. Understanding your microvascular system. Before we explore the connection between erectile function and heart health, we need to understand what microvascular health actually means. Your circulatory system isn't just made up of the large arteries and veins you can see. It includes an intricate network of tiny blood vessels called capillaries and arterioles that are microscopic in size. These microvessels are absolutely critical for delivering oxygen and nutrients to every cell in your body. They're so small that red blood cells must travel through them in single file, like cars going through a narrow tunnel. Despite their tiny size, these vessels make up the vast majority of your circulatory system. Your microvascular system is incredibly sensitive to damage from high blood pressure, diabetes, high cholesterol, smoking, and inflammation. When these risk factors are present, the delicate lining of your smallest blood vessels begins to deteriorate, reducing their ability to dilate and contract properly. This process, called endothelial dysfunction, affects the inner lining of blood vessels throughout your entire body simultaneously. It doesn't just target one organ or area. It's a systemic problem that impacts every tissue that depends on these tiny vessels for survival. The anatomy of an erection. To understand why erectile dysfunction serves as an early warning for heart disease, we need to understand exactly how erections work from a vascular perspective. An erection is fundamentally a hydraulic event that depends entirely on proper blood flow through very small arteries. The penis contains specialized erectile tissue called the corpora cavernosa, which are essentially spongy chambers that fill with blood during arousal. For this to happen, the small arteries feeding the penis must dilate dramatically, increasing blood flow by up to 25 times normal levels. At the same time, the veins that normally drain blood from the penis must compress, trapping the increased blood volume inside the erectile chambers. This coordination between arterial dilation and venous compression creates the rigidity necessary for sexual function. The arteries that feed the penis are among the smallest in your body, measuring only 1 to 2 millimeters in diameter. Compare this to the coronary arteries that feed your heart, which are 3 to 4 millimeters wide, or the carotid arteries in your neck, which are 6 to 8 millimeters across. Why small arteries fail first. Here's the crucial point that explains why erectile dysfunction often precedes heart problems. The smaller the artery, the more sensitive it is to damage and dysfunction. Think of it like plumbing. A small pipe gets clogged much more easily than a large pipe, even with the same amount of buildup. When cardiovascular risk factors like high cholesterol, high blood pressure, or diabetes begin to damage your blood vessels, the tiniest arteries show symptoms first. The penile arteries, being among the smallest in your body, are often the first to lose their ability to dilate properly. This is why erectile dysfunction can appear 2 to 5 years before any symptoms of coronary artery disease become apparent. Your heart's blood supply might be compromised, but because the coronary arteries are larger, they can still provide adequate blood flow under normal circumstances. However, during times of stress or physical exertion, when your heart needs increased blood flow, the damaged coronary vessels may not be able to deliver. This is when chest pain, shortness of breath, or other cardiac symptoms finally appear. The endothelium connection. The key to understanding this connection lies in the endothelium, the thin layer of cells that lines all your blood vessels. This remarkable tissue does much more than just provide a smooth surface for blood to flow over. It actively regulates blood flow by producing nitric oxide, a powerful molecule that causes blood vessels to relax and dilate. When your endothelium is healthy, it responds to sexual arousal by releasing nitric oxide, which causes the penile arteries to open wide and allow increased blood flow. This same mechanism occurs throughout your body. Healthy endothelium in your coronary arteries helps them dilate when your heart needs more oxygen. Cardiovascular risk factors damage the endothelium's ability to produce adequate nitric oxide. This endothelial dysfunction affects every blood vessel in your body simultaneously, but symptoms appear first in the areas with the smallest arteries, like the penis. Research has shown that men with erectile dysfunction have significantly reduced endothelial function throughout their entire cardiovascular system, even if they haven't yet developed obvious heart disease symptoms. Before we continue exploring this crucial connection, I want to ask you to hit that subscribe button and ring the notification bell. The information I share on this channel about men's cardiovascular health could literally save your life by helping you recognize early warning signs that doctors often miss. Your support helps me continue bringing you this vital health education. The timeline of cardiovascular disease. Understanding the timeline of how cardiovascular disease develops helps explain why erectile dysfunction serves as such an important early warning system. Cardiovascular disease doesn't happen overnight. It's a gradual process that can take decades to fully manifest. The process typically begins with endothelial dysfunction, often triggered by risk factors like poor diet, lack of exercise, smoking, chronic stress, or genetic predisposition. This early stage causes no obvious symptoms, but can be detected through specialized testing of blood vessel function. As endothelial dysfunction progresses, the smallest arteries begin to lose their ability to dilate properly. This is when erectile dysfunction often first appears, because the penile arteries are among the most sensitive to this type of dysfunction. Years later, as the disease process continues, larger arteries begin to show signs of atherosclerosis, the buildup of plaque deposits that can eventually block blood flow. This is when symptoms of coronary artery disease, peripheral artery disease, or cerebrovascular disease finally become apparent. By the time traditional cardiovascular symptoms appear, the disease has often progressed significantly. This is why erectile dysfunction represents such a valuable opportunity for early intervention and prevention. The connection between erectile dysfunction and cardiovascular disease isn't just theoretical. It's supported by extensive research involving hundreds of thousands of men worldwide. Multiple large-scale studies have consistently demonstrated this relationship across different populations and age groups. One landmark study published in the Journal of the American Medical Association followed over 9,000 men for an average of 4 years. The results were striking. Men with erectile dysfunction had a 58% higher risk of developing coronary artery disease, a 34% higher risk of stroke, and a 33% higher risk of heart failure. Another significant study from the Mayo Clinic examined over 1,400 men with erectile dysfunction and found that 57% had undiagnosed cardiovascular disease when properly evaluated. Most concerning was that 19% had severe coronary artery disease that put them at immediate risk for heart attack. The Princeton 3 Consensus Panel, composed of leading cardiologists and sexual medicine experts, has established clear guidelines recommending cardiovascular evaluation for men presenting with erectile dysfunction, particularly those with cardiovascular risk factors. What makes the connection between erectile dysfunction and heart disease so strong is that they share virtually identical risk factors. Understanding these shared risk factors helps explain why addressing them can improve both cardiovascular health and sexual function simultaneously. High blood pressure is one of the most significant shared risk factors. Chronic hypertension damages the endothelium throughout your body, reducing the production of nitric oxide that's essential for both cardiac and erectile function. Even mild elevations in blood pressure can begin to impair erectile function years before causing obvious cardiac symptoms. Diabetes is another major culprit, causing damage to both large and small blood vessels throughout the body. The high blood sugar levels associated with diabetes are particularly toxic to the endothelium, leading to accelerated cardiovascular disease and erectile dysfunction. High cholesterol contributes to atherosclerosis in arteries throughout the body, including the penile arteries. The oxidation of LDL cholesterol creates inflammatory compounds that further damage the endothelium and impair nitric oxide production. Smoking is devastating to microvascular health, causing immediate constriction of small arteries and long-term damage to the endothelium. The toxins in cigarette smoke interfere with nitric oxide production and accelerate the development of atherosclerosis. Chronic inflammation plays a central role in both cardiovascular disease and erectile dysfunction. When your body is in a state of chronic inflammation, it produces compounds that interfere with normal endothelial function and nitric oxide production. This inflammatory state can be triggered by various factors, including obesity, poor diet, lack of sleep, chronic stress, and underlying medical conditions. The inflammation doesn't just affect one organ system, it's systemic, impacting blood vessels throughout your entire body. Inflammatory markers like C-reactive protein, interleukin-6, and tumor necrosis factor alpha are elevated in men with both erectile dysfunction and cardiovascular disease. This suggests that controlling inflammation could improve both conditions simultaneously. Anti-inflammatory lifestyle interventions, including regular exercise, Mediterranean-style diet, adequate sleep, and stress management, have been shown to improve both erectile function and cardiovascular health. I want to hear from you in the comments below. Have you experienced erectile dysfunction and later been diagnosed with heart problems? Are you concerned about your cardiovascular health based on changes in your sexual function? Sharing your experiences helps our community understand these connections and supports other men who may be facing similar concerns. The connection between erectile dysfunction and cardiovascular disease represents an enormous diagnostic opportunity that's unfortunately often missed in clinical practice. Many men are more likely to seek help for sexual problems than for vague cardiovascular symptoms, making erectile dysfunction consultations a perfect time to screen for heart disease. However, studies show that less than 20% of men presenting with erectile dysfunction receive adequate cardiovascular risk assessment. This represents a massive missed opportunity for early detection and prevention of heart disease, stroke, and other cardiovascular complications. When properly utilized, erectile dysfunction can serve as a window into your cardiovascular health, allowing for early intervention that could prevent serious cardiac events. The key is recognizing that erectile dysfunction, especially when it develops gradually over time, should prompt comprehensive cardiovascular evaluation. This evaluation should include assessment of blood pressure, cholesterol levels, blood sugar control, inflammatory markers, and potentially specialized testing of endothelial function. Advanced testing might include coronary calcium scoring, carotid ultrasound, or exercise stress testing. One of the most encouraging aspects of the erectile dysfunction cardiovascular disease connection is that treatments that improve one condition often help the other. This makes sense given their shared underlying mechanisms and risk factors. Lifestyle modifications form the foundation of treatment for both conditions. Regular aerobic exercise improves endothelial function throughout the body, enhances nitric oxide production, and promotes the growth of new blood vessels. Studies show that men who exercise regularly have both better erectile function and lower cardiovascular disease risk. Dietary interventions, particularly those emphasizing whole foods, healthy fats, and antioxidant-rich vegetables, can improve both sexual and cardiovascular health. The Mediterranean diet has been specifically shown to improve erectile function while reducing heart disease risk. Weight loss, when needed, can dramatically improve both conditions. Excess abdominal fat produces inflammatory compounds that interfere with normal vascular function. Losing even modest amounts of weight can restore healthier endothelial function and improve blood flow throughout the body. Several classes of medications can benefit both erectile function and cardiovascular health when used appropriately. ACE inhibitors and ARBs, commonly used to treat high blood pressure, can improve endothelial function and may enhance erectile function in some men. Statin medications, used to lower cholesterol, have been shown to improve erectile function in men with high cholesterol levels, This improvement likely results from better endothelial function and reduced inflammation rather than just cholesterol lowering. Interestingly, PDE5 inhibitors like Viagra, Cialis, and Levitra, originally developed for erectile dysfunction, have cardiovascular benefits. These medications work by enhancing nitric oxide signaling, which benefits blood vessels throughout the body. Some men with both erectile dysfunction and cardiovascular disease may benefit from more advanced interventions like external counterpulsation or low-intensity shockwave therapy, which can improve blood flow to both the penis and heart muscle. Understanding the connection between erectile dysfunction and cardiovascular disease shifts our focus from treating established disease to preventing it in the first place. When erectile dysfunction is recognized as an early warning sign, it becomes an opportunity for aggressive risk factor modification. This prevention approach is particularly important because once cardiovascular disease becomes clinically apparent, it's much more difficult to reverse. However, when caught early through the erectile dysfunction warning system, aggressive lifestyle modification and medical management can often restore normal function. The goal isn't just to treat erectile dysfunction, it's to use this early warning sign to prevent heart attacks, strokes, and other potentially fatal cardiovascular events. This approach requires looking beyond just sexual function to address the underlying vascular health that affects your entire body. Men who develop erectile dysfunction, particularly at younger ages, face significantly increased long-term health risks that extend far beyond sexual function. Research shows that men who develop erectile dysfunction before age 50 have particularly high cardiovascular disease risk and should be evaluated aggressively. The presence of erectile dysfunction also predicts increased risk of other vascular conditions, including peripheral artery disease, which can lead to leg pain and potentially amputation, and cerebrovascular disease, which increases stroke risk. Understanding these connections empowers men to take control of their health by addressing modifiable risk factors early in the disease process, when interventions are most likely to be effective. The connection between microvascular health, erectile dysfunction, and cardiovascular disease represents one of the most important concepts in men's health. Your erectile function isn't just about sexual satisfaction, it's a window into the health of your entire cardiovascular system. If you're experiencing erectile dysfunction, especially if it's developed gradually over time, don't dismiss it as just a normal part of aging. Consider it your body's early warning system alerting you to cardiovascular changes that need attention before they become life-threatening. Take this opportunity to work with your healthcare provider to assess your complete cardiovascular risk profile. Address modifiable risk factors through lifestyle changes and appropriate medical treatment. The interventions that improve your sexual health will likely improve your overall cardiovascular health and potentially add years to your life. Remember, erectile dysfunction doesn't have to be permanent, and neither does cardiovascular disease risk. With proper attention to your microvascular health, you can often improve both your sexual function and your long-term survival. The key is recognizing the connection and taking action while you still have time to make a difference. If you found this information valuable, please hit that like button and share this video with other men who need to understand these crucial connections. Subscribe and ring the notification bell so you don't miss future videos about men's health topics that could save your life. Stay healthy, stay informed, and remember that your sexual health is an integral part of your overall health. I'll see you in the next video.